Hypothyroidism, a diagnostic approach. A 17-year-old girl is brought to your office complaining of progressive weight gain of 4 kilograms or 8 pounds in 6 months, fatigue, and cold intolerance. Her pulse is 55 beats per minute. Other vital signs are normal. Examination shows dry skin and delayed relaxation of the ankle jerk reflex, also termed the Woltmann sign. With these clinical signs of hypothyroidism in mind, thyroid function tests are requested. Laboratory studies reveal increased TSH levels with 12 milli-international units per liter and decreased FT4 levels with 0.3 micrograms per deciliter. Let's take a close look at how to interpret thyroid function tests. The first marker used to assess thyroid function is TSH, thyroid-stimulating hormone. If the TSH level is normal, hypothyroidism is unlikely. On the other hand, a high TSH indicates primary hypothyroidism, whereas a low TSH indicates secondary or tertiary hypothyroidism. The next value to look at is FT4, free thyroxine. A high TSH and normal FT4 indicates subclinical hypothyroidism, a condition in which the thyroid gland recognizes thyroid hormone deficiency, resulting in an increased TSH. However, FT4 levels have not yet decreased. On the other hand, decreased FT4 levels suggest a relevant deficiency in thyroid hormones and is classified as primary hypothyroidism. Let's go back to the interpretation of TSH values in the first level of the flowchart. A low TSH level together with a low FT4 would suggest secondary or tertiary hypothyroidism. Secondary hypothyroidism is due to the failure of the pituitary gland to secrete TSH, whereas tertiary hypothyroidism is caused by the failure of the hypothalamus to release TRH, a thyrotropin-releasing hormone. In both cases, the thyroid gland does not produce enough FT4, causing hypothyroidism. To confirm the exact cause, further follow-up is required. Okay, let's analyze the patient's laboratory findings. The reference value for TSH is 0.5 to 5 milli-international units per liter. An elevated TSH value of 12 was found. The reference value for FT4 in adults is 0.7 to 1.8 micrograms per deciliter. A low FT4 of 0.3 was detected in the patient. Based on these laboratory findings, the patient has primary hypothyroidism. Information regarding further follow-up and management can be found in the respective chapter.